Hello, and welcome back to another episode of Straight Up with Steph. If you've ever struggled with TMJ issues, or you have patients that struggle with it, or headaches, or migraines, or neck pain, this is the episode for you. Today, I'm interviewing someone who I actually did an Instagram live with. It was probably about a month ago now, but he is a physical therapist that specializes in jaw issues, neck issues, headaches, that kind of thing. And he's just such a cool person to talk to. He's a wealth of knowledge and he's someone that has over 1 million social media followers, and he puts out such good content. Like, I put out videos, but I really look up to him as far as the quality of his videos and what he's doing because they are so information packed. It's crazy how much knowledge and education he can fit into like a 1 minute video. It's crazy. But I wanted to bring him on the podcast to talk more specifically about things like TMJ, TMD, neck pain, posture, ergonomics, the nervous system, and how all of that fits together. I know a lot of people listening to this podcast are in dentistry, or if you're just interested in overall health, you've probably had the experience where you have pain somewhere. Maybe you do some exercises or you get some new equipment that's supposed to help, and you still have that pain. Dr. Joe today talks about why that is. It has to do with our nervous system and how it remembers pain. It's really interesting. And he created a whole protocol that's not just exercises that you do and hopefully it'll help. He talks about rewiring the nervous system and rewiring that pain loop that a lot of us find ourselves in, where we're just kind of going round and around trying to do these things, fix things, get new equipment, change our habits, whatever it is, and we're still in pain and it just seems like we're spinning our wheels. And of course, jaw issues. So many people struggle with jaw pain, and it's actually a lot of times connected to our neck, which can trigger headaches, migraines. And it's just hard to know kind of like where the pain is actually coming from, especially if someone is experiencing pain in all of those areas. We break all of that down on today's podcast, and I really hope you enjoy today's conversation with Dr. Joe. Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Dr. Joe. Thanks for joining today. I'm so stoked for our conversation.
Me too. Thanks for having me, Steph.
Yeah, it feels like we just did our live, and here we are talking
Yeah,
again. It's great.
it really does. The time flew.
Yeah, I know, especially right now. I don't know about you, but things are just crazy. Like, I know the rest of the year is just going to fly by.
Yeah, that transition like from summer right into September is it speeds through. So yeah, before you know it, it'll be New Year's.
I know. And I don't know if you do this, but I'm like, okay, in a couple months it's going to slow down. And then it just like never does. But I keep telling myself
No.
that.
Yeah, no, nothing ever slows down. And once you see time for an open space, you just fill it. So
Yep. Yeah.
never ends.
Yeah. So you are a PT, but you have chosen to specialize in like TMJ, headaches, neck pain. What made you decide to focus on that?
Yeah, so it initially started completely randomly, which was that I was working in a clinic and the front desk came back and they said, does anyone, I have a patient on the phone. Does anyone want to work with him? They have TMJ. And it was just me and one other therapist. And the therapist was like, I'm not sticking my hands in anyone's mouth. And I was like, I'll do it. I'm like, whatever, no big deal. And that was like over 10 years ago now. So that kind of started, but in the beginning, I really didn't really know too much of what I was doing. I knew I had school education, some couple courses, but I was just kind of getting by. And what happened was once you start specializing in that area, like TMJ, there's a lot of people, which I've come to realize over time, even more so, that other practitioners and doctors, they just don't know what to do with. Whether it's like TMJ, it's headaches, it's neck pain, it's migraines, it's this funny ear fullness, it's this dizziness. And so once they find out, hey, he specialized in this one area of the face, maybe he can help with this. And then before you know it, I was getting, referrals from the ENTs, from the neurologists, from dentists, everybody. So kind of built up from there. And then in like 2016, then I started getting neck pain and headaches on one side.
Hmm.
Not necessarily TMJ. I did have like jaw tension and discomfort, but I started having neck pain and headaches. And it was one of those things where I was like, all right, this will go away in a week, 2 weeks, 2 months. It can't last longer than 6 months, a year. This literally was going on for years. And so it kind of just all built. So I started with TMJ. I was getting the referrals. Then I started experiencing that. And that's what really, I mean, if you want to have like a trigger that throws you deeply into something, It's when you start experiencing yourself. And
Yeah.
so, and then plus it starts helping you connect the dots. So you, oh yeah, that person used to tell me about this. They used to say it wouldn't go away, or they, they said that it hurt on one side. Like this is all making sense now. And that's when I know we're going to talk about a lot of stuff, but basically that's when I realized like, okay, so it's not just about the exercises. Like there's a nervous system piece, there's a lifestyle, it's all together. And then I always heard people saying this, and then I could finally relate to it. They were like, I just feel like I'm like, it's like a loop. I can't break out of it. I get better, and then I like fall back into the loop. And that's what formulated everything that I do now.
So, yeah, you do talk a lot about this loop. So, like, what is that? What do you mean when you say that? And how is that different than just like traditional therapies like chiropractic or people going to see the PT like once a week? How is that different?
Yeah. So it's different because healing, your experience, your life experience, what you're perceiving right now, like on the podcast with me right now, it's a combination of all your senses. And so it's all of that. It's your vision, it's your feel, it's what you hear, it's all of it. And your nervous system is responsible for processing all that. So with traditional movement therapies like chiropractic, like physical therapy and acupuncture massage, you're working on a actual mechanical symptom, but your body, just like a pulse from the environment, just like things are going on in the environment around you right now, your body experiences physical things that occur, but it sends all that information up to the brain, and your brain is what decides what you experience. So your senses just send signals to the brain, they don't tell it anything else, and your brain takes that and interprets it into, oh, this seems like it could be bad, maybe I'll make them feel pain, or maybe I'll just make them feel relaxed, or oh, like there was a lot of pressure on the toe right now, but it's not really dangerous, so I'm not even going to feel pain. And that would be an example of like if you ever woke up and had a bruise somewhere and you don't remember getting it. It's
Hmm.
like, oh, so your body, you experienced that and your brain was like, oh, we don't need to send pain, it's not that urgent. So it's like ping pong between the body and the brain, and if you're just working on that one side of it, you're not working on the body's ability to change the perception. And then there's the lifestyle piece, which obviously is something that you specialize in. And the other thing is, let's say that you have a physical injury and it's sending signals up to the brain, and then that physical injury heals. And so it sends normal signals up. If the brain is still in a state of misinterpreting and believing that there's a problem, it's going to make you feel pain. So you can't just fix the body. And at the same time, if you do neuroplasticity work and understand like it's not the end of the world, and like this is how I process symptoms and this is the stimulation and understanding all that, but there's still a physical injury, you're still going to get the pain, the bad signals from the body. And so then the brain has no choice, even though it's in a healthy state, to make you feel pain. So you have to be working on both sides. And then if you get both of those firing properly, but you keep putting yourself into a situation where one of them is going to go into a dysfunctional state, well, then it doesn't matter if you fix these two because you're in the wrong environment or lifestyle. So it's all interplayed. And certain injuries, there's a lot of injuries that get better very quickly. And so it's like, oh, I was playing soccer, I pulled my hamstring and I went through the protocol. And that's actually a hard injury to get over, but
I've
and it
heard.
heals. I stubbed my toe, I banged my wrist, it hurts, it's better, it's fine. But there's also a portion of the population where it doesn't go away, and it's like 3 months, 6 months, year. And those are the people where they need to start using a lot of these strategies. Usually I tell people, if you have a new pain, it's like, give it a couple of weeks, like it might just go away on its own, there's no need. But then some people don't fall into that box.
So it's like when you're explaining it, like if
Mm-hmm.
I was in pain and you were telling me all these things, I'd be like, "Oh my God," like almost overwhelmed, right? Because it's a
Yeah.
lot to think about. So
Mm-hmm.
with your system and how you teach people and get them out of pain, like is it a systematic thing where you're kind of
Yeah.
addressing everything and can people actually get better with it?
Yeah. Well, definitely people can get better. And
Yeah.
there's a starting point. So I always tell people to go to the site of the pain first, because you can get overwhelmed, like you said, with what I just said, or just you can go on the internet and be like, my
Oh my God.
posture isn't working well. And it's like, well, it's your collapsed arch, it's your pelvic floor, it's your core. It's like, well, where do I even start? Go to the site of the pain. It's like if it's the jaw here, if it's the neck here, if it's the shoulder here, let's just go to that area. Let's start moving it. We basically have like an algorithm where like we start with this movement, and how does your body respond to it? Does it get better, worse, or does it stay the same? Based on that response, now this is the next thing we do. And you just kind of go through that. So
Mm.
everyone has a starting point. And for some people, that starting point's perfect, and then they start getting better. For other people, they do it and there's no change. For other people, it makes them feel worse. But either in any scenario, The only way to progress is to actually take information and learn from it. And so we just need to do something as a starting point. And then that's the way it works. And usually we'll start with a movement starting point, gain a little traction like that. And then, like in the beginning, I just like to educate about the nervous system, but like not throw strategies in there because you don't want to be doing too many things at once. So we set what's called the musculoskeletal foundation first, and then we transition into the neuroplasticity rewrite. And so just you have just like a jump off point, and it's everything is about control your variables, introduce something, better, worse, the same, make the next decision, and just go through. And it's
Almost like a flow chart, right?
yeah, it's like an algorithm that you
Okay.
use. And then that way you can have you want clear information when you've been in pain for a while.
Yeah.
When you muddy the waters, a month turns into a year like that. And so a lot of times people want to jump in and do like 7 different exercises and do all these different things because I want to better as quickly as possible. And that might work for some people, but most people that won't. And then at the end of that bout, you haven't learned anything because you don't know what made you better, worse, or the same. So then you have to start over. So that's the whole point of starting very small.
Okay. Yeah, that's a lot more like digestible than
Yes,
trying to
yeah.
do everything at once. And that's how I
No.
am. It's like if I have an issue, I'm that person who will do 10 things at one time and then I don't know what worked and what didn't
Yeah.
work.
Yeah, so the first part is just understanding the whole thing, how it works together, but then it's about just you start with one thing, it's like anything else, and then you move on to the next.
So the nervous system piece, could that explain why, like I work with dental clinicians a lot, and
Mhm.
they'll, for example, they go and get this pair of loops that I recommend that really promotes a nice neutral head position, but then they're
Okay.
still in pain and they're like, my posture's better.
Yeah.
Shouldn't I be out of pain? And they're either in the same or worse pain. And this doesn't happen all the time, but sometimes. And I'm just like,
Mhm.
so
Yeah.
is that the nervous system like almost remembering pain? And it doesn't really matter about the postural changes?
That could be one scenario. The other thing is so the lifestyle piece is the lifestyle piece you have to clean up, but like when you're thinking about the nervous system and the physical body, there's also different categories for the physical body and posture. Some people, just when they're slumped forward, things are getting irritated. And when you take them out of that position, it feels better. That's just
Mhm.
one like bucket. A lot of people who have had an issue for a while, the tissues have actually shifted out of position. They've gotten like more pathologically lengthened or shortened. So you take them out of that position, and like yeah, that compression's not happening from the posture bad posture position, but things are out of position, and that's when we need to actually use specific movements over and over again to reposition to bring back to its normal state. So most people fall into that category who the longer you've been in pain, the tissues have been in such a position so long that things have actually changed into a different position, and so that's when you need more specific movements. And the other thing is, you know, it's all about doing like we split up the movements in my group into recurring, daily, and weekly. So there's some movements that are recurring. So you're going to do this like 6 times a day. It takes 5 seconds, 10 seconds, but you're doing it like 6 times a day. Then some daily are just we need you to do this once a day. And then there's a weekly where it's like, well, now we just need this foundational thing a couple times a week. And that's how you're getting the result because there's, you know, building strength, if you were going to build stronger biceps, you wouldn't lift as heavy as you could every single day. You would lift and then you would take a rest day and let them build up. That's just for strength. But if you wanted to teach the nervous system to do a really light job all the time, then you would want to regularly throughout the whole day retrain it to do it and do it and do it. So we just need to break things up into categories and then like execute in that capacity.
Okay.
Yeah.
So that's like kind of evening out the muscle imbalances that people just develop because of like maybe poor posture or just like muscle weakness.
Yeah, and then also like the joints, the disc, the ligaments, like things like that. Like they I actually have a model right now for anyone who watches it. But like if you fall into bad posture and you actually just collapse and just you could see how the positioning changes as that happens. Just the two structures compressing onto each other could be causing pain. You get out of the position, it's better. But if you've been in that position and then something in here just shifts out of position, and now no matter what position you go into, it's always out of position, that's when changing your posture isn't enough. And then we have to use different strategies to like reposition them. So it's also the joints and the ligaments, but then there's also muscle imbalances also.
It's so complicated. And I honestly, I think that's why people are gun shy as far as like treating TMD or TMJ because there are so many like moving parts. But
Yeah.
you've talked in your videos, I've scrolled through your feed in prep for today, and
Yeah.
you've been talking about dizziness a lot. So
Yeah.
how is the jaw and neck and dizziness, how is that all related?
Yep. So when you think about our vestibular system, which is our balance system,
Mhm.
is composed of input from our eyes, so what we see. It's composed of input from the inner ear, which tells us our head position. So there's crystals in our ear, and when you turn, when I tilt left, they tilt more to the left, and when I tilt right, they tilt more to the right. And there's sensors in there telling us like, hey, we feel. This is very very broken down, but basically like the inner ear is like, hey, we feel the crystals on the right side. I bet that they're tilting to the right. Oh, now we feel the crystals touching our left side. We must be tilting to the left. So that's how it gets information. Vision, if you start tilting the room, the first thing you see when you start changing your position of your body is the room relatively changes. It looks like it's tilting. So it takes that information, the inner ear information, and then there's something called proprioception, which is the length of the tissue. So if the tissue lengthens or shortens, there's receptors in there. So if suddenly the tissues on the right side of my neck shorten and the ones on the left side of my neck lengthen, our body makes a prediction that we're going to the right because it's tilting to the right. So it
Oh.
takes the information from the proprioception, which I just explained, the inner ear and the eyes, and then it puts it all together. And when that information matches, it has a very, very strong indication of what's happening and where you are in space and what you should do to maybe counteract that so you don't fall or you can manage your balance. So when any one of the systems is not firing properly, or if they're firing properly and it's not being processed properly, but let's just stick with if any of the systems are out of position or not working properly, there's a mismatch of information, and then that produces dizziness.
Mm.
And so, if your proprioception is good and your inner ear is good, but you're having visual issues, then it creates a mismatch and confusion and balance. If you're having an inner ear problem, same thing, and proprioception. Now, most of the time with the inner ear, you get what's called vertigo. So vertigo, everyone knows vertigo when they get it. It's intense room spinning, it's debilitating, it's just sudden, and it's hard to function with. Most people don't have that. That does happen. I mean, it happens frequently, but most people who I encounter don't have that. They say, "Oh no, I can function. I just saw someone today. Like I can function. I can do everything I need to do, but I'm uncomfortable. I feel like lightheaded when certain things happen." So if it's not the eyes, because a lot of people had vision checks and everything's fine, very commonly there's a proprioception issue where the tissues in the neck and shoulder region are just imbalanced. And so there's always a tug one way versus another, and there's getting that mismatch of information. That's why the neck is so important. And the other thing is the jaw, the nerves to the jaw actually have this connection, not a hard connection, but it just goes to the same area as the nerves of the neck. And it's called the trigeminal cervical complex. And so, actually, if there's a problem with your jaw, it can send information through that straight through to the neck. And then that produces dizziness because the body sometimes can't tell where it's coming from. And
Mm.
so it thinks there's a neck problem when it's really a jaw problem and produces dizziness. And that's also why, vice versa, some people with neck problems have jaw pain because what happens is it goes right through that nucleus and it goes to the jaw. So they think they have a jaw problem, but it's a neck problem. So I
Do you
just
see
threw a
that a
lot at you.
lot? Like,
Yeah.
if someone comes
Oh,
in and
yeah.
they just have TMJ, they think that it's just TMJ pain, and you're like, "Well,
Yes.
actually, it's like a neck
That's
issue," and
like a third of the cases probably. And then there's even specific ones where they turn a specific way, a certain movement, and every time it's an intense pain right to their jaw.
mm,
Um, so, and it sounds like, we're just talking. This is why my social media is so demonstration heavy because if you can demonstrate, like it's when we're talking about it, it can sound complicating and it's definitely not straightforward, but when you break it down, like there's ways to test and like put people in buckets and understand like where to go with treatments. Like I'm actually doing a talk next weekend at this thing called the Treat TMD conference. It's for dentists, and the
mhm.
whole talk is talking about if someone has jaw pain, is it a TMJ joint issue? Is it a muscle issue, like from a fascia muscle issue from clenching and imbalances, or is it a neck issue? And those are the three buckets. And here's a quick way to figure out which bucket they're coming from. So it's just so important. Like that topic is what I'm actually doing a lot of talks on that. Because if you can get people to understand that, there's going to be a lot of people there's going to be less misdiagnosis and then people can get better quicker because it's all about just starting with that right treatment.
Well, I bet And I don't wanna, like, put dentistry down or anything like that, but I bet that we have made a lot of mistakes with patients because traditionally like, I've been a dental hygienist for, I don't know, pushing 20 years, and
Hmm.
whenever patients come in that say that they have a TMJ issues, first thing is just to throw a night guard at them. Sometimes
Yeah.
it helps, sometimes it doesn't, and when it doesn't, it's like that's our tool. We don't really
Yeah.
have any other tools in our toolbox.
Yeah. And that's why this is so important to understand. And that's why, like, I've done this talk a bunch of times before, and now it's getting accepted into like bigger conferences because
Mhm.
even just having a starting point assessment tool, and it's like, hey, if you can, the hardest part is getting someone to do something out of their routine during their evaluation, like a dentist or anyone, even a PT. If you tell them
Yeah.
to do something different, they might be resistant to it. But if you take like 3 minutes and say, like, sit like this, turn like this, do like this, okay, this might be coming from your neck, boom, referral out. Or this is a TMJ joint issue, which dentists have a better idea, understanding of that. Like, okay,
Mhm.
there's a click, a shift, etc. But then also there might not be a TMJ issue, it could be a clenching issue. So if you just have like a very brief assessment form, it's just a better way to triage more quickly.
So, what do you recommend for like dentists, for example, if they have a patient that comes in saying that they've got TMJ pain? Um,
Hmm.
what's something that they can do to determine is it the jaw or is it the neck?
Yeah. So with the, for example, for the joint, to know if it's an actual temporal mandibular joint disorder.
Hmm.
So just something you can do right away is just have them move through the jaw, the TMJ mouth opening range of motion. So it's like opening, closing, shifting forward, back, left, right. You can feel on them. Do you feel clicking, popping? Does it resemble your normal typical discomfort? And or is there limitations? Does the jaw shift in a certain direction? All of that is going to be more indicative. Plus, if it's very specific, like, oh, it's just right over here, it hurts. It's not so much here and here, but it's like very here. That's just one brief way to do it. Then another thing you could look at, if you go through that and you say, oh, they don't have any of that, but they're saying they have just discomfort and it's even a little more broad on the side and up here as well. Oh, and I'm looking at their teeth, they're pretty worn down. Could they be clenching? Oh, they say it's worse in the mornings too. Maybe they're clenching at night. Then they might tell you that it's more of a myofascial issue. And if they say, like, it's when I eat, it's when I talk, when I've been using the jaw, it gives you a little more information that this is, and then you feel too. So you know that there, especially a telltale sign of clenching is that the pain is up here
Okay.
because the temporalis is like such a driver of clenching. So then that might just give you a little more information. Now, if they say, oh, it's when I've been sitting for a while, you may have them sit down for 60 seconds in a bad posture versus up if it actually comes through. If they talk about headaches through here also and dizziness, again, the neck might be driving all of those pieces. And especially if the jaw didn't click and the muscles on the side of the head weren't getting super tender, but all those other tests are positive, and then they have some different postural defaults you look at, you go into the next. So that's just like a starting point to start getting your mind thinking. And then there's other things you can do after that to be more, all encompassing. But
Okay.
that's just a rough, good starting point.
Is there something just going back to dizziness? And I just like what you mentioned earlier, when you have personal experience with something, it really makes you a lot more like curious about it.
Yeah.
I have had this vertigo issue for probably a year and a half, and it's only when I'm driving. It's called like binocular vision disorder. So when I'm driving
Okay.
really fast on the freeway, that's like the worst time to get vertigo, but
Yeah.
it's terrible. I hate it. So is there any like I don't know, home things that people can do to help like reduce their dizziness, or is it not that simple?
Well, it all comes down to starting points and
Mm.
determining what to do. The what the biggest lever to pull is, because with science, there's always multiple factors going on, but
Yeah.
it's like, what is the actual biggest one lever to pull? And with dizziness, if this is someone who says it doesn't seem like this sudden spinning vertigo, right? It's not that. And they did BPPV testing, which tests the crystals in the ear. They did tests and it seems like everything's negative. And then they went to the vision doctor and the eye doctor and they had their vision checked and everything seems to check out. And then they start telling you, I do have tension up here in the upper neck and it's when I've been sitting for a while, I have a desk job. Then that starts telling us, okay, maybe this is a neck issue.
Yeah.
If we want to test it further, what you can do is really slump down for a minute or two, kind of tilt in that position, see if you could provoke it. But if you can't provoke it and you still want to try, different things you could do, very, very simple starting point, can even be just grabbing your chin and placing it against your chest and lifting up behind the head and just holding like this and giving like 30, 60 seconds. doing a couple of these. You could even put heat back there and start massaging the very upper neck through there and just see if that gives you any type of result. And again, I kind of mentioned this before, and I actually told someone this who I was just working with before this. This strategy, if this makes you better or worse, either way, it's pretty much a win because it's starting to point you in the right direction. Better, obviously, like you've done something that helped. But if you say, oh man, I'm immediately dizzy now, it's like, okay, bingo, like we're in the right area. Usually, pain, I always tell people go towards the pain. That's something we talk about in my group a lot. Obviously, not excruciating pain, but if something triggers you and makes you irritated, then it's like a compass. It's telling you, like, hey, the problem's right over here. So let's keep going towards it.
Okay.
And so that's a big piece of the puzzle that people get wrong, because I very commonly find that things that if I work with someone and they get better, they look at the things that we did and like, you know what, I actually tried a couple of these in the past, but it made me so much worse. I stopped, and that was a year ago or 2 years ago. And I'm like, wow, like we could have saved you 2 years of time if like you just understood how to now go deeper into that, and with the right controlling your variables and knowing how to adjust the intensity, the duration, the frequency to get you to the point where it was going to work for you.
Hmm.
And so it's really like you can find any, another thing I tell people is like any strategy that can help you, or any strategy that I use, you've seen on my social media or anywhere else on the internet, but it's about knowing which one is it and then how to implement it. The selection and the implementation, like that is the key. It's not the exercise, it's how you incorporate it into your life. And then that's just the musculoskeletal piece. And then we have the nervous system and all that.
Yeah, it's so complicated. You talked
Yeah.
too about brain fog, and it never
Yeah.
occurred to me until I started watching your videos that like that was connected with, jaw and neck pain. So is
Yeah.
that just because of the nervous system too?
I mean, it's definitely because of the nervous system. And basically, if you think about your brain as like having processing power, like a computer, the more programs you're running, the slower everything gets. When you're running the program of like, oh, my eyes burn, I'm a little bit dizzy, it just takes away from your mental energy, from your
Yeah.
clarity, and it produces that feeling of brain fog. The other thing is a lot of people who experience these things have part of the nervous system piece of it, like the emotions around it, about like, hey, I've went to 10 different doctors, they're telling me different things, I'm confused, or I have this trip coming up, I was really looking forward to it, and like, what if I have this episode during the trip, like what's the point, like all of these, am I going to be able to work and take care of my family, all these things. And then so those emotions, just like someone who's in a depression feels like they can't get out of bed,
Yeah.
just those emotions that are running through your brain, again, just kind of knock you down a notch, and just it can all compound into brain fog. So a lot of people will say, my body feels strong. I can exercise, I can work out. I'm not any weaker. I got 8 hours of sleep, but I'm just like, it's something about, and you can see it in their eyes. Like as soon as they start doing this whole thing with the eyebrows and the eyes, it's like, my body is strong. Like I feel I should be good, but like, why is my head tired? And again, it's just, everything is just too much.
Yeah, I think too, because I get like that. Like my vision dizziness issue is getting better because I'm doing these eye exercises that's helping. But
Nice.
anytime, so I do a lot of speaking events, and like I just did one that I had to rent a car and drive an hour. And for
Mm.
probably 2 weeks leading up to that, I was totally stressed out because I didn't know if I was going to have an episode. And I was like, I am
Yeah.
like exhausted and I haven't even gotten there yet.
Yeah. Yep. I mean, that's what it is. That's
Yeah,
exactly
yeah.
what it is.
There is a lot of emotion that's attached to all that stuff too. So you've helped a lot of patients, whether in person or with your online programs. Are there any like common patterns that you see with them as far as issues that they have or things that they've tried that haven't worked in the past?
Yeah. So things that haven't worked in the past, I mean, it's really a little bit of everything.
Yeah.
The thing is, most people who just have an initial injury occur, if it doesn't go away on its own, they'll do some type of rehab, and some of them will get better. And all it took was a couple times a week. You go there, you do that, maybe some home exercises. But the people, again, that I'm dealing with, where it's like been going on a while, it comes down to also volume, to doing enough of it frequently enough and understanding the problem. The thing is, until you've gotten to like a certain point of suffering, you reject the idea of having to take this on your own, learn it yourself, do stuff on your own, research, like learn, like as if you're studying to be, you know, some type of practitioner. But then
Yeah.
people hit a point and they're like, okay, they're like, all right, so it looks like I can't just go to somewhere and lay down and be like, fix me, and then like come back the next week. They're like, I guess this has to be like a whole shift for me. And then they're in. And that is the number one driver of success, people who are ready to consume. Like in my
Mm.
programs, there's like, I mean, if you see my Instagram, my social media, like it's just education, like as much as you can fit into a short period of time. The program too is just strategy, education, so that by the end you're like, okay, I know how to manage it. Like the more you know how to manage it, the more empowered you, because like fear comes from the unknown. So when you don't, so once you get that knowledge and understanding, that alone calms down the nervous system. And then plus you have strategies, and then you become more brave. Like, okay, I'm going to do this, and if it flares up, I know how to fix it anyway. So it has to be a piece of it. It absolutely has to. So anytime you've done something, if you've been suffering a long enough time, and if you've done something that didn't involve that education and that personal ownership and having to go through strategies throughout the day, every day, it doesn't matter what it is, it's not worked for those people.
Mm.
And then the patterns that I see with people, honestly, it's like just a combination of between the jaw, the neck and shoulder, and then headaches, dizziness. It's just like a crazy drawing, randomly connecting all of them, like because it is so all interconnected. And so you can't actually treat this in a vacuum. Again, the people who want to treat it in a vacuum, they've gotten better already. They just did something for their jaw, they just did something for their neck. But like most people here that I work with, they need to be addressing the neck, the jaw, the shoulders, the nervous system. And we just put it all together into a nice process where we can hit all of it. So yeah, there's not really like one trend, I would say. I mean, there's a lot. I can go into so many random ones, but
Yeah.
it's just all interconnected. And a lot of people have done their due diligence. Like I went to the ENT, I went to the dentist, I went to the eye doctor, I went to the neurologist because I thought I was dying for like a year. And I went to everyone over and over and over again, and everything is negative. And then most people fall into that, thank God. Like nothing, there's never like a major finding, and it's just somewhere in the gray area in the middle.
Well, I just appreciate your program because what it sounds like to me is you're giving people the tools for like life. And what frustrates me with us as dental clinicians is so many of us are like in pain and we're just going to the chiropractor every week or going to PT or going to massage and we're not actually like we don't have any traction. And so I feel like your program like people go through it and they have the tools to manage their issues for like the rest of their life.
Yeah, that's the whole goal of the program, to just give the tools, but not make them part of it. You have to go through that piece. For example, like I unlock one level at a time, and some people get in and they're like, well, like I paid for it. Give me all of it. I'm like,
Yeah.
no, I'm going to make you only get one level at a time because I don't want you to skip ahead. And then, people will tell me after, like, at first I didn't really get why you were doing that, but like now I get it. Like the longer the time horizon that you give to get better, the higher the results are. So like if you force someone to take their time over 12 weeks, they're going to have a much better result than if you just let them kind of cherry pick which exercises feel good.
Is that just something that you learned over time, or did you start that from the get-go?
No, that's something, I worked, my first job was in a neuro rehab hospital. I had done internships in like really pure orthopedic hospitals. And then I was telling you about that other job. And all of those jobs, I had worked, actually, one of them was like every patient every 40 minutes, but like then it was like every 20 minutes, every 15 minutes. And you only learn so much. And then I started working for myself only in person, 1 hour sessions with everyone. And that's when the psychology comes out, the
Mm.
subtle patterns. You start seeing like how people responded. And then there's just like you just have to be kind of in the trenches with them. And then after doing that, then all these patterns and frameworks that I'm talking about, they just start emerging. There's not really like a shortcut on it. You just got to be in the trenches. And then something interesting happened too. Before I started doing this, people would just come in and talk about their physical injury. But once I started talking about the nervous system more and we had more time, we were there for an hour together working, it was almost like I opened the floodgates to them to talk about like the emotional part and the fear and all this, because they didn't think that they like had permission, because before like it was just like, oh, this is PT, I don't want to like be weird and talk about too much. And then like, well, once you open that door, now all of a sudden you're getting all this information. You're like, oh my God, how was I supposed to get them better without all this information in the first place?
Does that kind of frustrate you as far as our whole medical system that people are just they're just not you don't have the time that you actually need to
Yeah.
treat people?
Yeah, no, definitely.
Yeah.
Yeah,
Yeah, it's
that's a, it's
tough.
a big problem.
Yeah. It's like that with dentistry too, and it's I don't know, it just seems to be getting worse, but so going back to posture, is that something else I mean, obviously I talk about that a lot, but
Yeah.
clinicians will be, and I'm sure patients do this too, seeing PT, massage, chiro, all the things, and then they're going back to their like terrible workspace or
Yeah.
ergonomics. So how big of a factor do you see that as far as like headaches and jaw pain and stuff?
Yeah, I think that's huge. It is. I mean, it's wherever you're spending most of your time.
Yeah.
So it's absolutely a big problem. And yeah, I think I think you do a great job with that. I think that that's, especially like niche specific and generally like just understanding the position your body needs to be in.
So
Yeah.
how does head position, how does that relate to like jaw pain or neck pain?
Yeah. So a couple just fundamental elements is that if you're the upper neck contributes is like C1, 2, 3, cervical spine levels 1, 2, and 3. They innervate and contribute basically like head up. So when there's a problem, it can cause dizziness, it can cause headaches, it can refer to jaw pain. The middle neck, like around C3, C4, down to the bottom, they refer down, pain on the neck, down the arms, to the fingertips, shoulder blades, a little bit on the front of the chest. And when your head is forward, you actually not only compress the upper piece, but you also kind of like you're lengthening in a bad way the lower piece. So this can produce those symptoms that go up and the symptoms that go down. The other thing is as your head shifts forward and as you come forward, the muscles that go from the neck and the collarbones onto the jaw start getting lengthened and they pull the jaw backwards. And so this is actually part of the talk that I'm doing next weekend. And if we're just going to get technical for a second, but like the head of the mandible, the bone on the top of the joint of the jaw that sits in the joint that's on the disc, that's below the disc, it can shift forward and the disc, or it shifts backwards and the disc in the TMJ shifts forward. So then when you open and close, you start hearing that clicking.
Hmm.
And sometimes that could be a joint issue itself only, but other times just because the muscles pull the jaw back, you're sitting in that position. And sometimes I'll have people sit up straight and open and close and like, oh, now I don't click. So it
Hmm.
actually changes the mechanics of the joint. So that's just a couple different things that could produce all of the different symptoms. Then it closes down the muscles on the chest. You can't get as deep of a breath because your rib cage is compressed down as you're forward. So your diaphragm can't do a proper expansion of the rib cage, so you can't get as much air in, and you start shallow breathing, and then you start using other muscles that connect to the head to lift the rib cage. So it's definitely a whole domino effect.
It's just a whole thing. I know. And I talk to dental clinicians about like using these loops that they're not having to hunch forward. They can be straight up.
What
But
are
same with
those loops that you're referring to?
they go by different names. I call them ergo loops or ergonomic
Okay.
loops. They're also prismatic or deflection loops, but it's basically got like a little mirror in the scope and the scope's angled down so that it like
Oh,
bends your vision, almost like looking through a microscope so you can see
yeah,
down.
yeah.
Yeah, but you can have your head upright. But I imagine it's the same with office workers too. Like if they're just hunched over their
Hmm.
laptops all day, like you
Yeah,
need to, I know you've done some videos, raise that laptop up so you can keep your head more upright. Same with cell phones, like it's a whole
yeah.
thing.
Yeah, and there's actually, they have these glasses like what you're talking about, but for rock climbers. So when
Yes.
yeah, you're belaying, you're holding the rope at the bottom, you can look up at the person above. I've had like a handyman or like people who are working construction who have to look up all day. I recommend those to them, and it like makes a big difference because they don't have to actually look up. And then another big thing is people who are cooking. Cooking is like a big problem because you have to
Yeah.
look down and chop the whole time. So I've had some people get the ones that reflect down, which is what you use. I mean,
Mhm.
obviously yours is a much higher quality instrument, but these are just cheap ones, and it looks straight down. But it really does help until you can get out of that pain cycle and then
Yeah.
start looking down. Because there's absolutely nothing wrong with looking down or turning your head any other way. It's just when you keep it in that one position for too long that it becomes more what we call pathological. And that's the other thing with posture too. No posture is one size fits all. There are people that I've run into with insanely severe scoliosis that said they never had pain before, or like completely forward hunched posture, never had pain before. So some people can just get into different positions without pain. But typically, once the pain hits, then that position is really going to limit them from getting better, also. So it's not just the posture, but also like how long you hold yourself in that posture.
Yeah.
That's the thing.
Yeah. Yeah. And I try to
You
get
don't have to
people
be like a
to,
robot all day.
right. Because that just builds tension, right? If you're just
Yeah, it
trying to
builds
be all
more
rigid.
tension.
Yeah, you gotta
Yeah.
move around a little bit. Yeah, but I mean, in dentistry, oh my god, we're just like
Oh
this
my
for
God, I can only
hours.
imagine.
It's terrible, and then we get up and we're like, "Why do I feel like the Tin Man right now? This is crazy."
That's can you like have people stand up or something? Like,
Yeah, I recommend
is
standing,
that a
trying to
new thing?
alternate sitting to standing. Yeah, there's a lot of things, moving different positions so you're not like in the same position. But it's, I mean, like when we're working on patients, we're focused on them. We're not worrying about us. And then all of a sudden, an hour has gone by and we haven't moved at all. And then we're all in pain.
Yeah,
Yeah,
definitely.
it's tough. But I know every profession has their own issues.
Yeah, it does.
Yeah, I don't get my nails done that much anymore, but when I did, I would just feel so bad for the nail techs because same thing, they're just hunched over for
Oh
that
yeah.
entire hour, you know? It's
Mm-hmm.
terrible.
Yeah. Forget about the fact that all those chemicals they're breathing in all
Oh
day.
my gosh, I know.
It's got to be
It's
so bad.
no, it's yeah, it's terrible. I don't envy them. So do you have some like top exercises that you really like prescribing to people for like neck or jaw issues?
Yeah, yeah, definitely. So along the lines of what we're just talking about, just getting our bodies into a better position. Like I said, if someone has an upper neck issue, which dizziness, headaches, maybe even we think something's referred from the neck to the jaw, that one I showed before about just opening up the back of the neck is just a great one to start decompressing the area. And most people benefit from that in some capacity. If you pull too hard, it could trigger a little something, but just starting with that straight up is a great strategy.
Okay.
For the actual lower and mid neck, even just doing a classic chin tuck is a solid exercise. And for anyone who doesn't know a chin tuck, it's just about never changing the plane of your head. You're looking straight ahead, and then you're just bringing your head straight back like you're trying to make a double chin. And you just come back and forth. You can push on the chin a little, just trying to get you out of that forward position and back. Because again, what we were saying before, remember you're saying like some people you fix their posture, they're not better. Sometimes they just need a little more force to get through the movement.
Mm,
So that's a nice one to start with. And just those two alone kind of address the upper and mid lower neck. And people fall into different, again, buckets. A certain percentage of people will respond to that, but certain people will do that. And then it's just like, oh, now just this one side hurts. And then there's like the next steps. But those are great starter ones. For the jaw, something that's nice to do. There's a couple different very basic ones. But again, with general starter exercises where we're not achieving something specific, we just want to create mobility, pretty much centralized mobility. So we wouldn't be like, for anyone who has neck pain, just do this to the side, like because we don't know about one side versus the other. So that's why I'm like, go straight up, bring the head back, and even with the jaw, just one you can do is bring your tongue up to your roof of your mouth and like that,
uh-huh.
opening and closing. And what that does is when your TMJ operates, it rotates and then it translates like the joint, like this. It rotates and translates. The translation where the jaw shifts forward, that's where people who have disc and joint issues usually have most of the pain. So if we could just keep people in the rotational component, we can help lubricate the joint and stretch it out a little. So just by putting your tongue up to the roof of your mouth and just opening and closing, we just do that rotation before there's a shift, and we can again loosen up the joint a little, lubricate it, just get it into
Okay.
a better position, and then you move on from there.
Is that something to like if someone is a clencher or maybe grinder at night, is that something you would tell them to do first thing in the morning before they like start eating or even start talking to kind of loosen it up?
Yeah, that could be one if the joint itself is hurting because that really
Yeah.
gets the joint. People who are clenching and grinding, I would probably tell them to release. The biggest problem with those people is that the muscles are sore. If you haven't, the longer you clench, the more pressures on the joint and you could cause an actual joint issue. But if
Okay.
it's just clenching and you don't have an issue with the joint I was just talking about, it's just those muscles just hurt from being on all the time. For those people, heat in the morning and just like kind of massaging it would be a good starting point in the morning.
Okay.
In terms of stopping clenching, there's more like stimulating the nervous system, setting up your day the right way, making sure you can get restful sleep, doing stuff like to relaxation strategies before sleep. And then there's also appliances that you can use to help. So you're going to have the strongest bite through the molars. So if you can actually have a night appliance that shifts you forward just a little bit, where it's more of the context happening towards the front, sometimes people won't clench as deeply, and
Mhm.
that can also relieve them also.
Yeah. What are your thoughts on Botox for jaw?
Botox, yeah, it's definitely not a go-to strategy.
Okay.
It's something that can be used as a tool, though.
Okay.
So I don't you shouldn't, in my opinion, you shouldn't do it right away. It shouldn't be the first thing you do. You want to
Okay.
do the conservative strategies. The more Botox you're also putting in there, you're also changing the integrity of the joint or muscle that you're injecting into, or the muscle that you're injecting it into. So you really want to use other strategies that we've talked about. And then some people with migraine syndrome where it's just everything keeps clamping down and like you feel like you can't even make progress, going through a Botox protocol to just calm everything down and then do the strategies while you're in a better state. So by the time the Botox inevitably wears off, you've done the groundwork so that you're in a better position. That can be, it can be used in that way. It
Okay.
could also be used diagnostically. So if you think, hey, it's one of these like four muscles has to be locking up on them, a good practitioner who does Botox would do like a multi-step procedure where they inject just the masseter muscle, and then you come back a week later and you do just the temporal tendon, and then just the medial pterygoid, and you wait to see which one did you get the release from, and now you understand the problem better. So it's a good diagnostic tool also.
Okay. So maybe like a temporary type tool, but not something someone should use for the
No,
rest of their
no,
life.
no, no, absolutely no.
Okay.
Most people I don't recommend it to. It's just like those severe cases.
Yeah. What about home like tools? Because there's a million, if I go on Amazon, there's a million different things,
Yeah.
and I'm sure a lot of them are just complete BS. But are there some things that you recommend to patients that actually work?
Yeah, I like any type of release ball for the upper neck. Like there's these peanut balls, the Da Vinci tool. They're just suboccipital release tools. Those are good ones. A good TheraBand. I mean, TheraBand is great because you can just use it for strengthening in so many different ways. I like some massage hooks where it's like a big hook
That
and
like
it comes
cane
down.
thing?
Yeah, the cane, you can put that in different areas. Those are the main ones I really, because the thing with my world is that you can reach everything with your hands. It's such a good
Mhm.
area of the body to self treat. So if you just get something to release the suboccipitals, a hook to get deeper areas, those are just great starting points.
And something like the cane, because I have a couple of those. I have a bunch of stuff. I have like one of those trigger point massagers too. But those are those designed really to work on the fascia?
Okay, so basically those, it's no, not necessarily. You can use it for the
Okay.
muscle also.
Okay. What
Yeah,
just real quick, this is something I wanted to ask you earlier. What role does fascia have with everything that you do? Because I know you've been doing a lot of videos about that lately too.
yeah. So it's a tie-in. You have to understand that all the tissues in the body are connected with this fascial tissue. And so a restriction in one area can have an implication up the chain. So if we're just targeting certain muscles, we're not taking into account that it can also be tight because somewhere along that pathway, the tension builds, lower down by the hip. And if we can open that up, then that muscle is going to have more freedom also. So
Mm.
that's really where it comes in from a mechanical standpoint. Other people feel that there's a motion stored in the fascia, and then if you can release that, you can have more deeper releases. So that's another piece of it as well. I use it really as a tool to be able to get like full body mobility. And that's why there's certain movements and releases where you can get multiple areas at one time. That's not something I target immediately. I always start with more of like the repositioning things. And then as we move down the chain, so like the framework that we use also is we go to the source first. Where does it hurt? And we're going to
Mhm.
treat that first. We're not going to waste our time, like looking at your left knee because your hips are uneven. We're just going to go right there, get you the relief, start healing that area because that's the pain generator. So there's a tissue that actually is generating your pain. Forget why that tissue is, but it's generating your pain. If you can unlock that, you don't have less pain. Now let's figure out why that tissue keeps getting pinched. Okay, then you look down the chain of things. So you start up at the head and move down and down. So usually as we move into it a little more, we'll go into more of the fascial components.
So that could, I mean, fascia could explain why, like, if I've got tight hips and I'm just stretching the hell out of my hips and it's not really helping, it's probably because that restriction is actually coming from somewhere else, right?
Yeah, like it could be like all the way down by your feet and or up through the back. Like if you've ever, done like your classic hamstring stretch and you really sink all the way down, especially like if you do it in the mornings or a time when you're tight, you'll feel like in your neck, your toes tingle. That's also nerves that go through the whole body, but it's the same concept with fascia. It goes through the
Mm.
whole area. So we need to get targeted and whole body as well.
Yeah, it's just crazy how complicated it is. And with fascia too, it's just funny how we used to just completely ignore that. Like we're like, it doesn't count.
Yeah, I think, the body is complicated. And we're just, we're at the infancy of understanding it. Like we've come a long way and we have a long way to go. But it's just about, and because this is like my bread and butter. This is what I do all day. This is why sometimes taking a video, Like there was a day, I think last week or the week before, where we took, I think it was just the only video we shot the whole day. It was like 6 7 hours, and then for like a 2 minute and 30 second shoot a video, two
Isn't
minute
that
video,
crazy?
or a minute 40 second video. Because if you want to get it right, there's so many factors you have to understand. And then once you understand what you want to say, it's like, how do you demonstrate it? And then, so again, that's just trying to condense a concept into a short video. So when you're trying to heal yourself, it's about condensing down all the factors and finding the biggest lever to pull. Once you do that using frameworks, and that's how I work with people, it's all about like frameworks. Like, all right, we're trying to fix our posture. We're going to use this framework, like SAS, or like we have like a I don't fail. Like, so if someone has a flare up, we have a framework of like I don't fail, where you're going to first, just to give you an example. So let's say you do an exercise and it flares you up. We want to know for sure if that exercise is going to help you or not. So the IDF, the I don't fail framework, is that we're going to cut all three factors by 50%. So the intensity is going to, which is the I, is going to cut down by 50%. The duration, so how many reps, down by 50%. And the frequency, instead of every day, it's every other day. And then you do that at a very tolerable rate. And then you start increasing one at a time. First, you start increasing the intensity. So you start going deeper and deeper, like more resistance, till you can get to a good point. Now you do that more times. You get the duration all the way back up to where it was. And then finally you add it back in every day. So again, that's like a framework you can use to get yourself through it. And if you have enough frameworks, then that like compile onto each other, you have just like a simple system. And that's really what it comes down to for these cases. Like, or else it's a mess.
It's like chaos, right?
It's chaos. So it
Yeah.
needs to be systematized.
Yeah. And that's what I love about your system, because it is very systematic. And so you're not just like doing random stuff and then who knows what's actually working.
Yeah, that's the key for everything. So
Yeah.
I love it.
Yeah, that's awesome. Well, thank you so much for your time today, Dr. Joe. I know our listeners learned a lot.
Thank
If
you.
they want to connect with you or learn more about you or from you, what's the best place for that?
So they can go, all my social medias are at Dr. Joe Damiani. They can go to my website, PhysioLoops. So it's just physioloops.com. Also, I have my revitalization program. So basically, it's for anyone who's suffering with TMJ, headaches, or neck pain. And it's been lasting a while. If the things I talked about here kind of resonate with you, I have that program where it's 12 levels. You work through every level. There's a community. And then there's also group calls with me every week. And then like I analyze your posture and your pillow setup. And then also we have, so we're just adding in additional things like the posture. We add that in. So it's all different segments. So it's a 7-day free trial. And actually I have a coupon code for your listeners, if that's all right.
Of course. And I'll make sure
Yeah.
that's in the show notes too. Yeah.
Okay, great. Yeah. So anyone who joins with the coupon code STEPH, STEPH,
Mhm.
it'll be 30% off every month because it's a membership until you hit your goals.
Oh my gosh. Well, thank you so much for
Yeah.
that. That's
Yeah,
awesome.
absolutely. Yeah.
Yeah.
Thank you. I really appreciate it. We had a great this is our second great conversation. So we'll have to come up with more like sub niche topics.
Well, there's so much to talk about when it comes to this
Yeah.
stuff. So I'll make sure to put all of your contact information and just all that stuff in the show notes, so it's really easy for everyone. And thank you so much again for your time.
Thank you so much. I really appreciate it.
All right. And thank you everyone for listening. We will see you next time. Thank you for tuning into this episode of Straight Up with Steph and being interested in living better. What many listeners do is subscribe to the podcast because that allows them to automatically get the latest episodes of the show. Remember, you are the best person to take care of you, and by learning what we talk about on this show, you're taking one more step to being a healthier and happier you. I'll talk to you soon.